Welcome to the weekly Benefit Roast, featuring Benefit Indemnity Corporation's president, Rodger Bayne. Rodger has devoted more than 30 years to understanding and developing innovative health benefits plans for large groups and groups as small as 5 employees. Our moderator is Bob Graham. Take it away, Bob.
Hello and welcome to the Benefit Roast. You may be wondering where this name came from, because I've had a couple people ask me about that. The name comes from an idea that Rodger and some of the brokers way back in the early days, like we're talking, I think the 80s and early 90s, back before Hillary Care and Obamacare and all the care, back in the early days of HMOs, used to get around a table, as I understand it, drink coffee and talk about the issues involving the insurance world, good, bad, and ugly. And as we were coming up with the name for this benefit roast, he mentioned that to me, and we thought we'd build on that. So now we're doing it over an electronic platform. We are roasting benefits in the sense of sometimes we're talking about the things that aren't working with benefits, and other times we're talking about the great aspects. And also because he did cups of coffee back then, and he was a provider. If you stay on till the end of this webinar, there's a way that we can actually provide you with a cup of coffee, believe it or not. So you'll want to stay on for that. Couple of housekeeping matters before we get to today's really exciting topic. If you want to contribute to the discussion, the easiest thing is to write in your comments in the chat box on the right of your screen. You can also raise your hand. There's a way you can press a button to raise your hand if you want to be involved in the discussion. We'll try to get you on the call, but it's not as easy as it looks for us sometimes. But we would love your comments. I see a comment from Denise who says, I'm thrilled to be here. Denise, we're happy to have you. And I see a comment from Joe saying, I made it in time. I guess Joe had a busy Monday. I know the feeling. So thanks, Joe, for joining us. I've got other comments I'll work in as we go. But today's topic is how to build your benefits up from the ground up. And this was something we started talking about 2 weeks ago when we were talking about how self-funding works. And Rodger, why don't you take us there and start that discussion?
Okay, I can certainly do that. I mean, I think when we talk about micromanaging our health plans, and last week, not last week, but 2 weeks ago because of the holiday, we kind of really talked about drilling down and doing some better things. And now when we're talking about building your health plan from the ground up, we have to talk about the core argument to do that and why to do that. And I think first and foremost, building a health plan sounds like a big deal. And to most people, that might be a big deal, but not really. So when we talk about the employer's need to build their own health plan, first we got to talk about the employer's desires, right? Most entrepreneurs, most CEOs, most CFOs or chief operation officers, a lot of these C-suite folks, executives and business owners, one of the things they want most is control. That's control of their destiny, control of their operations, control of how they run their business, control of their products, because they have their name on it. They have a stake in the game, and they want to make sure that they're doing it the right way. If they can control it, they can make sure they adhere to quality standards that they want to have in their health plan.
They also are controlling the budget as well, right?
Well, that's certainly another piece of that.
Oh, sorry. Did I get ahead of you in your PowerPoint?
No, you're okay, because that's all what's important. That's what Bill out here has just said. Well, what about cost? Well, you guys are just getting a little bit anxious. So
sorry.
We did just start the call. So anyway, the customization is also real important, right? Because most employers say, well, that's not what I want to do. I want to do it this way, or I want to do that, or I want to figure out something else. And certainly when they come up with a good idea, it is critical that you can generate and develop and work with them on that idea, or emphatically know why not.
Okay.
Innovation is critical. You need to deliver, but you also have to make sure that employers understand the pitfalls of some innovations in technology. So that's a nice piece of this as well. But the big thing also is you want to cut your spend.
There it is.
The number one issue beyond payroll is the cost of benefits in this country, right? For most employers, it's the second highest overhead expense. And that is an outrageous thing to consider.
Or they're not offering it at all because it's so expensive.
Or they're not offering it all because it's just too pricey.
Which really says a lot.
Which says a lot and really has to hurt a lot, right? So,
sure.
So the key to this thing is there's a lot of good reasons, and then there's really one good answer. They don't really have to run it anyway. They're going to hire the appropriate people to run it. And so that's what we mean when we say build your health plan from the ground up. So when you look at a health plan today, you look at the most rudimentary procedures, and if I were to tell you what is the first obligation of your health plan, most people in a room would say to pay my claims, right?
Yeah, sure.
But that's not the most rudimentary. Oftentimes we forget just how much goes into a health plan. And this is why an employer would never truly want to run their own unless they had Amazonian levels of employees, right? You'd have to have a massive number of employees to even consider jumping in and running your own health plan. You hire the appropriate parties that have experience in running health plans to build your micro plan.
But you're talking about something different than traditional insurance, right, Rodger?
Absolutely.
I've got a question from Caroline who's saying, why wouldn't I just go to one of the carriers and let them run it for me because they're the experts?
Well, you can do that, but those carriers are oftentimes locked into their own method of operation. And sometimes that fits, and we do a lot of that, and sometimes it doesn't fit.
And federal regulations affecting how they do that, right?
Well, but not if they self-fund as well, right? A lot of the carriers will create plans that allow an employer to build their own health plan, sort of. But the big carriers typically create their own model, and you have to adhere to that.
Okay.
So the innovation is no different than you might see in their other products.
Well, that's not innovation then.
Well, sometimes it's even less, and the flexibility is oftentimes compromised. So there's a lot that goes into that. But let's go back to the building blocks of building your own health plan. Paying claims isn't the most rudimentary piece. What's the first rudimentary piece? What does every employee demand the minute he gets a health plan?
A card.
Yeah. Who's going to print the ID cards?
That is the single biggest issue.
And what, Bob, is that ID card going to say?
It's going to say that we're going to cover you when you need to go to the hospital or wherever.
The ID card's not even really going to say that. The promise of benefits is made in another document, right? So we got to give them that. The ID card is simply a reference piece for the medical provider to know who to call, to verify benefits and eligibility and determination of benefits, and to get their claims filed.
This is sounding very complicated for someone who's telling us that this can be done by an employer, Rodger.
What I can tell you is that there are firms that specialize in this and do very, very good. And our industry calls them third-party administrators.
Or TPAs, right?
A TPA. And a TPA's skill set is comprehensive, detailed, and meticulous. But it's very comprehensive in that they are going to take this thing from billing and enrollment. You know, we forgot billing. Even before you get an ID card, you got to get enrolled.
Right.
So you have enrollment. Once you do an enrollment, you got to generate a bill. And you got to generate ID cards. And then you have to generate summary plan descriptions that describe the benefits. And SBCs that the federals require, right? The summary.
What's SBC?
The SBC is the summary of benefits certificate, I guess. The SBC under the ACA, the Affordable Care Act.
Obamacare to some of us.
Obamacare required that we create an SBC, a summary of benefits and coverage. And that summary of benefits and coverage had to be done in the original law under a certain, 10-point, 12-point font in under 6 pages or whatever, or 2 pages. It was ridiculous. It couldn't be done. So the model template came out to be a lot more pages than it was. And the format is a lot less user-friendly than most employer plans were in the past. So it's become a compliance requirement that everybody has to do, but it's not the best description of benefits. So usually we describe benefits in additional ways.
Okay, so, you're scaring me. If I'm a small business owner, Rodger, you're scaring me with all this.
Well, I want you to be scared of doing a health plan all by yourself, right?
Okay.
We're not all by ourselves. You're not alone when you want to build your own health plan. You have a third-party administrator. You have an insurance company. You have
several, right?
Maybe several insurance companies, but usually the parts that you're buying are administration, insurance, and guidance.
Okay.
Right? So you need a really good benefit advisor. Some of the people on our call today are good health insurance brokers. Okay. Some of them are good benefit advisors. Some of them are both, but they are not all one and the same.
You don't mean the people on the call. You mean people, the brokers in general.
No, but I'm saying some on the there's some on the call. I mean, we've got a lot of people on the call, so it could be a broker, it could be a benefit advisor, it could be an employer or prospect, and somebody that wants to build their own health plan and wants to know how. So we're kind of talking to a lot of different audiences on this call because we put these invitations out in public, and that's who we get.
Okay.
So anyway, the important thing to remember is that you're not out there alone. You're not in a vacuum. You're buying major components of how this health plan runs, but at the same time, you can hold their feet to the fire and direct them to make sure you get the best benefit build that you can get. Right? So that's kind of what we do here at Benefit Indemnity Corporation. We work to put those component pieces together, make them available for our brokers that want to build plans. We build some plans that are turnkey, and we build custom plans when it's needed. So it all depends on what we're doing. But the most important thing that an employer needs to know is that you don't build a health plan in a vacuum. You use experience, time, proven wisdom, and you use the advice, the best benefit advisor that you can find, and you drive your health plan with innovation, with comprehensive controls, and means by which to cut your benefit spend without compromising the quality of benefits you want for your employees.
So it sounds like a lot of this comes down to the advisor in the equation. And I know back around the Super Bowl, if you remember back to the last Super Bowl, I can't remember who won. I think it was the Patriots yet again. And football season just started. We were talking, you and I talked a lot about the coaching aspects of what you do with employers. Can you make that parallel for us? Because I think that's a really easy way to explain how this relationship can work.
Yeah, I think that's probably a pretty good analogy. I think we used Belichick in some of our discussions, right? Not everybody likes
New England coach, Bill Belichick.
Not everybody likes Bill Belichick.
Indeed.
But everybody acknowledges that he wins, right? And so when you're talking to a benefit advisor or even a third-party administrator, you have to know that sometimes you're not going to enjoy the message or the method because they're telling you what must be done, what has to be done. Sometimes it's federal law, sometimes it's some other registration or requirement that has to be done, but it has to be done. But the real key is when it comes to innovating a health plan design, that also is critical. You're going to hear really solid messages from third-party administrators and from your benefit advisor. You're going to hear that some of these bigger companies are making money on prescription drug sales instead of just making money on insuring them. Well, there's a big difference between those two.
Yes.
There's a big difference.
And it's coming out of the employer's pocket.
Right. You take the employer's claim fund and you pay for a drug that costs you $200, but you charge the health plan $300. And you're using the employer's $300 and you're paying $200 for the drug and you're keeping the extra $100. That kind of practice is going on in pharmaceutical benefit managers all over the country every single day. So
how would I get to know that? If I'm an employer, Rodger, and I have coverage right now for my employees, what are the questions I should be asking to get at some of these issues? Because we keep talking about the issues, but where do you get the information?
First and foremost, remember that if you are fully insured by a health insurance company, they're keeping all of those profits, all of those rewards, and all of those proceeds, and there is virtually no guarantee of transparency. So if, for example, ABC Insurance Company even published a claims report for you and said, you know what, you paid us $100,000 in premium and you spent $110,000 in claims $40,000 of those claims were on prescription drug costs. But they're not going to tell you that on that $40,000 worth of prescription drug costs, they only paid $30,000 for those prescriptions, because they got $10,000 worth of rebates from the manufacturers for the distribution of that drug.
And this is happening with the big carriers.
Happening all the time.
The names that
every
we would
day.
know.
Every day. All over the place.
And the employer's the loser in that equation, right? And their employees.
The employer and the employees all lose when
they're able to offer less benefits, lower level of benefits, because the costs are higher.
Right.
They're not really getting that difference.
They're paying a middleman for components of their health plan that they didn't know a middleman existed.
Okay.
Right. That's really kind of the tough challenge in this. Right. We know that an insurance carrier's got to pay the hospital.
Sure.
But we don't expect the insurance company to pay the hospital less than what they charge us.
Right.
Right?
Yeah.
You expect that if the hospital is charging the insurance company a discounted rate, that discounted rate is what's going to be passed through to you as the insured person. You want to pay the hospital less if the insurance company is paying the hospital less. Well, that should happen with prescription drugs, labs, outpatient facilities, and everything else.
Now,
and it doesn't always happen that way.
You've been an insurance broker for years and years. Could I go to one of the big insurance companies as either an employee or an employer and ask them questions that would get at that rebate kind of thing that they're doing, or that amount difference?
I have never seen anyone be able to navigate an insurance company's system and platform on fully insured coverages to get all the way through to the actual cost of a drug or a prescription, and what the health plan pays for it, and what they were charged at the pharmacy.
Talk about faith.
Well, I mean, I've just never seen it. I tell a story often. I even had a I had a dentist fire me as a patient because I wanted to get to that information.
So you asked him, how much is it that this would cost?
My daughter needed sedation dentistry because she needed oral surgery, and she's having some anxiety issues at the time. Okay. This is 20 years ago, probably. And so I called, and they said, who's your coverage with? And I said, the big guys. And they said, well, we don't take their coverage. I said, what do you mean? They're the big guys. Well, we don't take them. We have our fee structure, and you'll have to file claims with them. And I said, okay, well, how much do they pay you? Well, we don't take their money. And I said, well, you do take their money, but you take it after they pay it to me.
Right.
So how much are you going to charge me, and how much are they going to pay me back, and how much am I going to be left holding the bag for?
Sure.
And she said, well, I don't know that information. I said, well, how about you give me CPT codes? Now, that's current procedure technology. For those of you who don't know, claims are filed using that code. This is what's provided by the doctor, and the insurance company pays on that. I said, if you give me the CPT codes that are required for this procedure, I can go find out what Blue Cross will pay me. And then I can find out what you charge.
Blue Cross or whoever it was.
Excuse me, Big Co. What they pay. And so she said, okay, let me put you on hold. And she came back from that conversation and said, Mr. Bayne, Dr. Todd says he no longer needs you as a patient. I said, what? He says, we don't need you as a patient.
Wow.
And I said, okay, fair enough. So I found another place to go. But the point is, it is so challenging when everybody has this ulterior motive and everybody has their own perception of their value and what their rights are with a health insurance dollar, right?
Right.
So trying to get through that transparency is very difficult. That's why smaller employers, unless you are a gargantuan, excuse me if I could talk, unless you are a gargantuan-sized employer,
big is the word,
thousands of employees,
okay,
you don't want to consider dabbling in administering your own health plan, because you need an administrator, a third-party administrator that understands the mechanics, the pitfalls, and the compliance issues so that you don't have that problem. So I guess my point is, You don't have to run your own health plan. You're going to hire an experienced health plan operations. And when you hire that health plan operations firm, they're going to help work with the pharmaceutical benefit manager. And if you tell your third-party administrator that you insist upon a pass-through PBM that's going to pass through the actual drug cost to the health plan with no markup and no additional sales commission to them, then you're going to get the right results. You're going to get the right components. But the problem is most employers don't even know how to ask for that and don't even know there is such a thing. So that's where it comes to the best benefit advisors. And honestly, most of the people on this call are probably benefit advisors worthy of that salt because frankly, they're here.
And they're coaches.
And they're coaches and they're involved in this conversation. And so sometimes you hear things from your coach that you don't like, but they make you better.
Right.
And that's what we all need to recognize is there are things that we need to do better. But the bottom line is still building your own health plan has tremendous value. And it has tremendous value because you're now moving into a self-funded platform. You're hiring somebody to do the nuts and bolts of the operation. And yet, when you result in saving money, because you add innovation and cost controls and transparency into your health plan, you get to keep those leftover dollars. And therefore, you've reduced your healthcare spend, gives you the ability to maintain better benefits for less money. And frankly, that keeps a lot happier employees on the books.
Probably keeps them in the job longer, too.
Well, it keeps them in the job longer. If you're in a type of company that values their employees and trains them and works with them and gets what they would consider to be really good employees, you don't want to lose those people, especially for something
right now. You can't afford to lose.
You can't afford to lose anybody in this structure. You're right. And so to lose people today based over something so trivial as a health benefit issue, as long as you're in the norm with the industry, I mean, I'm not saying you're going to cover cosmetic surgery and all of these new things. I'm just saying you should never lose an employee over the quality of your health plan. You should have a health plan that meets the expectations and the needs and can do that while controlling cost and spend. And sometimes that does mean innovation, and sometimes that does mean noise, meaning you've got to communicate with your employees and talk to them about how we're going to give you better benefits and how we're going to keep those costs into something that you enjoy and like, rather than just saying, go spend whatever you want to spend.
Right.
So that's the tough message in the healthcare world, is it's not always about paying some super futuristic provider to do, a broken fingernail.
Right.
Right. My gallbladder surgery thing, there's a lot of places that can do gallbladder. There's a lot of places that can do heart, but they're not always the same place.
No.
So let's find the appropriate settings. And again, that comes back to innovation. That's not the building of the health plan part, but the most important thing for everybody to know.
We have a question, Rodger, or a statement from Will. Will says, I think he's going back to what you were saying a couple of minutes ago, that the way this healthcare seems to be set up and the prescription benefits, it sounds a lot like car insurance, where you get in a little fender bender, you go into the body shop and they say, oh, is it insurance? And you say, yeah, it's insurance. And they say it's $3,000. And then you say, what would the price be if it wasn't insurance? And they say $1,800. And you go, wow, that's a big difference, because they know you're going to get dinged on your insurance if you put the claim in.
Right.
And they don't want to wait and all that.
So you get whacked if you do, whacked if you don't. Right.
So but two different numbers for the same procedure, right?
That is a very reasonable analogy. And when you look in
nice job, Will.
When you look in your PPO directories of doctors,
preferred provider
organizations, you'll find the same thing. We've done studies, not we, but I've seen studies done by various companies that have shown that in that same provider directory, you can get a good quality colonoscopy for $700 or for $7,000, just depending on which one you go to.
There are so many comments I could make right now, Rodger, but I'm not even going to go there.
Well, that's why it's such a good illustration, Bob. We'll just leave that to imagination.
Indeed. And you caught me for a second. I was like, wow, you're baiting me. But at the risk of going into colonoscopies, which is an area that I need to get one soon. So thanks for reminding me.
Yeah, there's your friendly 50-year-old reminder.
Thank you. That's great. So I think one thing that you really need to touch on right now, because you've been talking about this, how to do this, but one thing you haven't talked about is how the risk is covered, because I'm always fearful, and I talk to people all the time. They're like, I can't run my own insurance plan because I can't afford all that money. And if I get someone who's really sick, I'm out of business. So can you walk us through real quick how that works?
Yeah, that's actually pretty easy. There's three major components of building your own health
plan. Okay.
And there's a couple of subcomponents, but the three major ones make it really easy to understand. You have administration, all of the paperwork and contracting. You have insurance, and you have claims.
Okay.
Right? So if you have some administrative costs, some insurance costs, and some claims costs, those are the three major components. But the insurance company is the piece in the middle that prevents those claim costs from going over your pre-established budget. So when you build your own health plan, you're going to say, okay, what would it cost? Show me the budget, Mr. Advisor. And the advisor is going to bring in proposals from insurance companies and administrators that say, here's what your fixed costs are, and here's the maximum amount of claims that your health plan should pay.
A dollar amount.
A dollar amount.
So it's X. And if X is the number, you will not go over X in that year. Once you sign that contract, you're done at X, correct?
You're done at X number per employee. If you add employees or subtract employees, then there's always room for change, right?
Okay, yep.
But yeah, if you had a static population of employees, you get a 1-year contract. This is the number. That's what you're going to pay. Nothing more, but thank goodness, maybe a lot less.
And go through that real quick.
So the three parts: administrative costs, you're going to pay a rate for that. Insurance, you're going to pay a rate for that. Claims, you're going to set aside funding for that. But if it's not all spent because your employees don't spend it, then you get to keep it. Use it for next year.
So if my company were to spend $800,000, I just threw a number out.
Okay.
But in the contract, it said that we were liable up to $1 million. We would pay benefits up to $1 million. I'd get $200,000 back.
If you laid out the $1 million claims funding that they projected for you, and come in only at $800,000, then yes, that $200,000 would come back to you.
And what can I do with that $200,000? Is that in nice $20 bills, and I go and try to win the lottery, or really ramp up my golf club?
In the appropriate contracts and in the real world in which I live, that's your money. You get a check for it back. If I'm holding it for you as a convenience to help pay claims and process them, I'm a third-party administrator, and you say, Roger, here's $800,000. Go pay my claims when they happen. But anything else left over, I get back. And really, you break that into a monthly amount instead of the full year. But whatever it is, then you get all that money back, and you get a check for it back, and you can do anything you want with it.
It's not taxed. It's not.
Well, technically, it should not have been deducted until it was spent.
Okay.
And so it won't be taxed coming back.
Okay.
Now, if you're an employer that made a mistake and said, I'm deducting this $800,000 or this $1 million worth of claims projection, I'm going to write that off as a deduction this year, and you finished up in the next year and you got $200,000 back, well, that $200,000 would call for a revised tax return from the year prior.
And again, Roger and I are not tax experts, nor do we play them on TV.
And we're not giving tax advice. But what I am saying is something that you don't spend is not tax deductible as a health benefit.
Okay. And what do people typically do with the money? Because you're doing these refund checks, and we did an episode about them.
A lot of people are just using the money for the next year's benefits. They keep their costs in, they average it down over the next year.
So it's rolling.
I've had some groups that said, don't even send me the check, just credit it to this month's premium or next month. Or in some cases, we had 2.5 months premium free in the next year. So, I mean, it just depends on what goes in that respect. But the reality is, it's your money. Now,
and
this is
what. Rate go down the second year
your rate is based on your projected costs for the second year.
But if it were lower, if we had the first year as an example, and it was lower than what was projected, would typically the rate go down the second year?
Only if it was radically lower.
Okay.
Radically lower. If it came in Usually if your exposure, your risk, your $1 million that you talked about in your illustration, the insurance company probably expects 850,000.
Okay.
So if you came in well below that number, then maybe your renewal needs to be adjusted down. But if you come in around expected, then that's what's expected. And then we look at next year and say, okay, this medical condition is cleared up. The twin babies were born, and that's done now. And we're going to look at what your exposure and your expected cost will be next year based on inflation and everything else that goes in.
And Zeke's question is, and what if we spend more in year one in claims than we expected? What happens in year two? Does my rate go up like the traditional insurers? Well, he actually used a company name, but I made it in traditional insurers.
Your rate action for the second year in the world of self-funding is going to be based on your projected expenditures in the second year. So if the first year you blew through your $1 million because Bob had a motorcycle accident.
Why am I always getting hurt?
And now,
I'm like Super Dave.
And now Bob is either okay.
I like that part.
Or deceased.
Oh, great.
Or went to work for somebody else and isn't a risk on your plan anymore. Then your rate's going to be reflective of what the current status of that ongoing medical condition might be.
Okay.
So it can go either way. It can go up like the insurance companies, or it can go down, or it can go up in soft dollars, meaning, we're going to add a little bit to the claims account because of this. But if Bob says he's fine and everything's going great and his physical therapy is almost done, and lo and behold, over the next year, he was right and he doesn't have any complications and he doesn't have to do the knee surgery next, or any of that, you don't spend that money anyway.
And that's far different than traditional insurance, where they're just going to tell you, hey, based on the number of people you have working and the age bands and your community rating, this is what you're going to pay.
That's correct.
So this is really detailed.
This is really detailed from that perspective.
And I can understand year to year.
Oh, yeah. Every year to year is based on what we call prognosis. The larger the group, the more and more they get to experience. Meaning you have 500 employees.
You're going to see some heart issues.
You're going to see some stuff. You're going to see some stuff next year very similar to what you saw this year. Right?
20 employees, maybe not.
20 employees is totally random. Could be anything. You could have a heart surgery 1 year and you could have nothing for 5 years. So you just never know. I've seen 20 life employers go through the entire year with less than $2,000 in claims for the entire group.
Wow, those are some healthy people.
Yeah, and that's not that unusual in that smaller group, because they know, you get 15 guys out in the field hanging drywall that are young enough that they're hanging drywall, they're not married, they're not having babies. That's what they do. They're healthy as a horse, they're strong as an ox.
Yeah.
And they don't have any medical claims. Even if they need it, even if they should go to the doctor, sometimes they don't.
I remember back when I was hanging drywall all the time, I was healthy as
Yeah, I'm sure you did, Bob.
For those of you who don't know me, I'm tall and thin.
Anyway,
the drywall would own me.
Anyway, I think Bob weighs less than most sheets of drywall.
With the 10-pound brick soaking wet.
Right. So long story short is building your own health plan is very complicated, but it's very simple if you hire the right people to do it. And those people exist. It's not like you have to go find them. It's not that hard to find. There are good quality people out there. Between your advisor and my firm, or my firm, if you don't think your advisor has it, we'll find you an advisor that does. But again, we'd love to refer you to one of the advisors that comes to these types of calls, learns more every day, works with the innovation, and creates benefits that everybody can enjoy is valuable.
What's one question that I could ask my broker that would tell me the litmus test, if you will, like a Supreme Court judge? What is that one question I should ask that will tell me whether they are the right person to be able to help me build my own benefits plan or not?
Wow, you put me on the spot with that one. I would ask my broker to teach me about what my options are in the world of fully insured and self-funded benefit plans. And by the time that conversation is over, you'll know.
Okay. I think that makes sense. And also, I would guess, to the employer listening to this or watching this and says, hey, I've never even been exposed to the idea of self-funding as an option. And some of the things you've said today make sense to me. I've got those guys doing hanging drywall and they're healthy as oxes and they don't use a lot of claims. Still, we're paying a lot of money per month for them, or something else that resonates with you. That would be another sign, correct?
That's correct.
So you would argue, I think, every company should at least look at self-funding their health benefits as an option, correct?
Absolutely. In fact, we've used this quote in previous webinars. I think Dan started it, and he says, not every employer is right for self-funding, but every employer deserves the right to know if they are. Right? So they really should know. We will help you know. Okay. If you work with us and benefit advisors work through us, we will make sure that everybody in the equation knows what is appropriate and what is the best benefit strategy for you.
Okay. And if someone's struggling with this idea, say an employer, you'd be happy to talk to them and do more of this. Hey, here are the questions you should be asking. These are the things you want to do, because I know you're dedicated to educating people on this in the world, because you really believe in this. You've been doing this for over 30 years, and this is really your passion. So why don't, at this point, you give them your direct phone line, which I know he answers, because all day we've been having a debate about phone calls coming in, and I know he's anxious to get phone calls.
Anyway, Rodger Bayne, 443-275-7412. That's 443-275-7412. If you're an employer, if you're a benefit advisor, if you're a broker, or if you're new to the business, if you need guidance, you need information, you need to learn more about this stuff, just give us a call. Be happy to talk to you anytime, and we can help you through it.
And hopefully I can share this. You are someone who likes to be at work a little late. You're here till 6 p.m. East Coast time.
Lots of days.
More than me.
Well, maybe more than I want to admit to my grandkids. But anyway,
we're here. What I'm saying is we have some information, because we were looking at call logs today, that a lot of people are making calls late in the day.
That's true.
You're someone who's there. And if you don't get Rodger, I can assure you, leave him a message. He will be back to you the next day.
That's probably what's more important is if you don't reach me, leave a message and we will get back to you. There's no question about that.
So
anyway,
you want to talk about it? Go ahead.
No, you go.
Okay.
Make sure everybody gets your cup of coffee for joining us today.
If you've been paying attention, or if you fell asleep, either way, great opportunity for you. We talked at the beginning about how this was all wrapped around the idea of coffee. So to give you a little reward for putting up with us today and learning about self-funded benefits, and to honor the tradition of years ago, you can go to the attendee form at the link you see here. That's benefitindemnity.co, attended benefit roast. Go to that link, fill out the form. You've got to fill out the form, and we will send you a way that you can buy yourself a cup of coffee of your choice sometime in the next week. We'd love for you to buy it next Monday, right before we get on at 3:30 East Coast time. And that's our little thank you. You can also go to the chat box, and I see that link right there. You just click right on it. It takes you right there. Fill it out, and you will be getting something in the mail from us pretty quickly, and you'll be able to have a cup of coffee on us. And with that, Rodger, I think it's time to wrap things up. Another great episode. I learned a whole lot. Every time I learn something new, and I need to go book a colonoscopy this afternoon. So thanks for that.
Have fun with that. Thank you very much, everyone. Appreciate your time. Have a great day.
You've been listening to the Benefit Roast, a weekly discussion sponsored by Benefit Indemnity Corporation. Employers in a wide range of fields are using employer-owned health benefits plans to deliver better benefits to their employees at a lower cost. Learn more at benefitindemnity.co. That's benefitindemnity.co. See you again next week.